Welcome back everyone, Dr. Naveen here from UPSC Medico. I'm doing this video mainly to address those aspirants who are actually targeting 2024 year and also the upcoming batch who have just started their preparation for target year 2025 from medical science optional background. See, before starting preparing for UPSC exam, always there is a dilemma about optional, right? If you have a dilemma about medical science optional or any optional, don't feel bad because it's a usual phenomenon with any aspirant who is preparing for UPSC. But what is the dilemma surrounding around medical science as an optional? See, in the last in the last 3 years, I had seen almost more than 20 students last year or aspirants last year from medical science background who are in the list. And if you type it in the Google, okay, if you search in the Google, optional with highest success rate, it shows as medical science optional. So though the success rate is high, what I observed is overall the average marks for any medical science optional student who scores a rank are standing in the range of 270 to 280. Sometimes they're going to 260 and sometimes we even have 299 as the highest mark in last 3 years. Now this is where a lot of students are in a dilemmatic situation whether to go for optional or not. The reason being why we are unable to cross 300. Okay, though we have great number of doctors who are getting into the list, why the score is not increasing? Okay, first and foremost, as an experienced UPSC mentor, I am here for last 6 years. I have mentored around 1000 plus medical science optional students and we have around 40 plus rankers in the list just in last 2 to 3 years. Now what I observed is it might sound odd, okay, but very important thing is it's not about how much you score in optional. Okay, the whole UPSC game is law of average. That means you should perform well in general study subjects, that is above average. You should perform well in CSAT or logical understanding exam. I have beautiful doctors with beautiful answers, right? They're very good in clinical concepts. I think even if they set up a clinic now, they'll serve the people on a medical basis. But the agony is that even after scoring so good in grant test, even they're reaching a cutoff of 350 by 500 in the grant test, but they're not writing mains because they're unable to clear the CSAT, which is a logical or mathematical stuff. Though it is easy, we tend to ignore these kind of exams. And also the prelims based preparation, wherein you have to have a lot of knowledge on current affairs, and mains answer writing for general study subjects like history, geography. See, it itself is a new task for us. And on top of that, we also should be ready for interview in terms of communication skills, and interview is done on the general grounds, not on a specialist ground. When you have so many new things to be done, okay, doctor, after 5.5 years of extensive preparation of medicine, suddenly he should shift to general studies. He should compete with humanitarian subject students. So there should be a major brain shift. Lot of energy, lot of time goes in this shift so that they might not be able to concentrate fully on medical science as an optional. On top of that, like cherry on top of a cake, even though we have a guidance, because from third MBBS onwards, we tend to join any of the reputed coaching institute to continue our parallel PG preparation or foundation course, right? Thinking that that's gonna help. Many of the students, they don't even go for guidance, they want to do it on their own. Okay, these are two minute factors, but on a large scale, they do affect the score of the students. What I'm trying to tell now is, it's good to have a target of 300 plus in medical science optional. It is also important to understand that people with 265 marks in medical science optional are all India rank less than 50. That means it's not always about optional. For a doctor, we have new zone, new domains to explore, new energy to invest into. You have to learn all these new things in life. So that takes more time. If you don't do that, if you keep on hammering the medical science optional to bring glory to the medical science optional, you will end up becoming a good doctor but not an administrator. Your aim is to become an administrator, not a doctor, right? So in all these circumstances, what a beginner doctor without proper mentorship is doing is, instead of choosing medical science optional, He's choosing another optional which is related to either GS or science related optional, we call it as X. Now, the problem with a doctor who chooses X as an optional is, first and foremost, he's ending up spending more than 3 to 4 months which should be allotted to an optional. You can master optional in 3 to 4 months, medical science. Instead of spending that, he tend to spend 1 to 2 years, because other optional coachings, what they do, they give you extensive material, they make you work on value additions, they eat away all your time. Their final goal is to give you good scores in optional. They're at least worried about your rank. But as I said, the whole process of UPSC is law of average. Okay, you shouldn't be a master of something. You should be a pro or a little above the pro in all the aspects. You shouldn't be like a master of all, right? Little knowledge or above average knowledge will suffice. This is not my word. This is the inference of lot of topper interviews I had seen in the last 5 years, right? So that way, choosing an X optional kills time. Now you already have 90 plus new subjects. You are adding one more subject. In the process, you're losing your heart. See, for a doctor, medicine is always in the heart. Now there is a dilemma whether to listen to the heart or to the brain. Just to get that additional 20 marks in an optional, you're spending more than a year to master a new subject altogether, and you're ending up not scoring. Why I'm telling you? 9 out of 10 doctors who are in the list are from medical science optional background. This is the statistics. Yes, there are 1 or 2 odd doctors who are doing with other optional, but it's a different game. They take 3 to 4 attempts. As you more distance away from medical science optional, being a specialty subject, it becomes tough to revise and memorize and keep in touch with medicine, right? If you don't treat a patient. So that's why many of the doctors who are doing good with medical science optional are doing it in the first year of their post internship, immediately after internship, because they have fresh knowledge. So my take home from the initial part of discussion of this video is that yes, you might have an optional dilemma if you're preparing for 2025, or if you haven't filed your 2024 registration form, you're dilemmatic about which optional to choose. As a Dr. Navin, as I have mentored 1000 plus medical science optional students in the last 3 to 4 years, and we have 40 plus all India rankers, I'm telling you, medical science optional has highest success rate. Though we are scoring on an average 10-15 marks less than a usual competitor, at the end of the day, the same plus 2 marks are there in the interview. On an average, a doctor who is attending an interview is scoring plus 20 marks in the interview, because doctor inherently has this quality, right? He has good communication skills. So in such sense, they will equal out. Optional always undergo scaling. So don't worry about scoring high in optional. But if you are determined to score very good on optional, what is going wrong for those 20 marks, how to improve and get more than 300 in the next attempt, and if your determination is to bring glory to the medical science optional, I think this video is for you, because I have observed few common mistakes done by medical science optionals in last 2 to 3 consecutive years. So what I did is I have designed a golden guide to tell you, so what are the things to be done, okay, so that to score high in medical science optional. So I'll put thumbnail as how to score good or how to score high in medical science optional. If I put a thumbnail saying that how to score 300 plus medical science optional, I am not a good mentor. I'm directing you in a wrong direction. That is wrong thing to say, because the top 1 ranker also might not score 300 plus in an optional. It's not about scoring high in optional. It's about law of average. It's very important for you as a medical science or optional student to understand. So let's get into the important golden guide dictums. I have seen many of the medical science optional students under a dilemma, because most of the times during our MBBS or BDS or any non-MBBS courses, we are used to writing MCQ based exams, competitive exams. We are still in the mindset of an MCQ based exam, but let me tell you, this is an answer writing. It's a game of answer writing. Now, if you go to a PG coaching institute, if there is a small topic like, let's say, placenta, okay, the placenta usually is asked for 20 mark question in anatomy, but if you attend any PG institute coaching or a material, you won't get stuff which gives you 5 marks to 10 marks. On top of that, they will never make you practice images of those placental abnormalities, or how placenta forms, what is cytotrophoblast, what is. They will never make you practice those things, because they are of least concern for an MCQ based exam. But they are our top priority for medical science optional exam in UPSC Civil Services, which is actually a game of answer writing. So first and foremost, your take home, if you're watching this video, if you're very serious about your optional, okay, so the mindset should change. I'm not telling that PG coaching or PG material is not at all useful. I'm only telling that that might be the reason for you not scoring well in a game of answer writing. For example, you're going for you're going to play football, but you have a techniques of a cricket. Definitely, you might do good. Let's take a baseball, because baseball also has a bat in it. So it's like baseball versus cricket. Both are played with a bat, but the size, shape, dimensions, rules are different. So a cricketer might not perform, might he might bat, but he might not perform well in baseball. Vice versa is true. Okay, so I think better to fight a war with an appropriate weapon, right? So that is the first mindset, or let's say shift in the brain. Okay, shift in the mindset is very important. It's a game of answer writing. Realize that. So here, what is important is weightage of the question, images, presentation, introduction, conclusion, tables, flowcharts. So it's altogether different. So when you're starting, if after watching this video, if you're starting your preparation today, first and foremost, write it on a wall, on your preparation wall, that it's a game of answer writing. Second thing, when I say game of answer writing, I had evaluated almost 1,000 plus papers in just 1 year. I had seen students struggling to fill up the one side of a paper. If this is one side of a paper in an exam, there will be margins on the side, and there will be question mentioned with a weightage of 5 marks, because one side of a white sheet contains 5 marks weightage with margins. Now you get one side of a page, you 5 marks, you get to finish it in 3 minutes of time. So you should be able to fill an A4 size paper within 3 minutes. Within 3 minutes, and there should be at least 5 keywords that should be highlighted in your answer, and if there is a relevant image, that should be there. If there is an intro you can give, it is always well and good. So this is how you have to structure your answer, and you have to practice it from day one. I'm not telling you to do a daily answer writing program for medical science optional, because you anyway doing it for humanitarian subjects, right? The mains is the level ground where you all fight with. So definitely, at least for medical science optional, you have to follow this 1-5-3-5 rule for answer writing at the beginning of your preparation itself, just to keep you in touch with medical science as an option. And as I already told you, the key difference is images are crucial in the instruction column given by the board. They clearly mentioned for medical science optional, especially that wherever relevant, draw an appropriate image with color pencils. This is what is given in the question booklet itself. So indirectly or directly, the examiner is telling you that if there is no image, you are not going to get good marks. And I'm so sad to say 9 out of 10 students who are writing test series or combo course tests or daily answer writing program with UPSC Medico are not drawing images at all, because the drawing images is out of our book, because of this silly PG coaching, wherein they only teach you whatever is important conceptually to answer an MCQ, but that doesn't fit here for answer writing. You should draw images. So we have around, let's say, 400 to 500 beautiful images, exam relevant images in the UPSC Medico notes. Okay, and in the videos we do explain like how to draw, what image should be there for this special question, because you have to always search for an image. An image speaks thousands words, right? So you cannot represent 1,000 words on a one side of a page, but an image will give you more wattage or more marks. I have seen many of the toppers in the last 10 years who scored 300 plus are very good at images. So images will give you that 300 plus edge. Okay, mark my word. So start from today, daily draw one image. Like take a radial nerve, course of radial nerve, just draw it. Look at the placenta, what is bipartite, what is tripartite, what is an accentuate lobe in placenta, just draw it, rough sketches. So they don't want an artist there. Okay, if you're too good at drawing, you will become an artist, not a doctor or not an aspirant like civil servant, right? So at the end of the day, relevant image, neatly looking, not good looking, neatly looking image, well labeled image, that will serve the purpose. Okay, and very importantly, this exam is purely based on PYQs. When I say this, not PYQ, question might not get repeated. We all know, even for PG related exams, it is previous year topic based, so you have to focus on PYTs in 9 out of 10 times. Now, where we are failing to score that extra 20 marks, what I observed is that sometimes what happens, yes, though most of the times, 85% of the times in last 3 consecutive years, questions are repeat. But if you don't know the pattern of the exam, the pattern of the exam is like this: question number 1, 2, 3, 4 in section 1, question number 5, 6, 7, 8 in question 2. This will give you 250 marks. You have to attempt 5 questions. Out of that, question number 1 and 5 are mandatorily attempted. There is no choice. So in this question number 1 and 5, they are twisting questions. They are asking questions from unasked version, they're asking questions from gray zones, and they're asking questions from updates. I think if you want to score really well, okay, you have to keep looking at these aspects too. Okay, what we have done with UPSC Medical courses is, for last 1 year I have included all these unasked topics as a part of test series. Okay, I have updated notes to cover the gray zone topics, not only PYQs, even the other things. I'll tell you what are the gray zones in medical science optional. And also, all in addition to 2.0 notes and videos, we have uploaded and we have recorded all the national health programs and PSM related updates. I think every year we should be focusing on these three aspects to score that extra 20-30 marks. And it's humanly not possible. It's a manual labor for an aspirant who has to focus a lot on general studies, who is already uh, busy or overburdened with preparation of UPSC. What UPSC Medico is doing is, within the course we have inculcated these three qualities so that you get 100% maximum output. Okay, this is the major change I have done this year. Okay, and also we don't know some subtle changes to the syllabus in the terminology. Many of the students, while writing exam, they're struggling to keep up with the changes in the terminology or little changes in the syllabus. Actually, the syllabus booklet, are the inference of the booklet is not changing. It's static from 2011, wherein a major change in medical science optional syllabus happened. But what changed is some of the topic names in the latest editions of the books. And for an aspirant, medical science aspirant, who doesn't follow latest edition textbooks, it becomes tough to understand the change in terminology. I'll also give you what are the changes happened in the syllabus to the terminology. So these unasked thing, gray zones, PSM updates, and subtle changes to the syllabus are our next topics of discussion in this video. Very important. So what changes have happened? Now we don't call Millennium Development Goals. Now we have changed it to Sustainable Development Goal, and the target is for 2030. And after 2030, if you're giving an attempt, if you're watching this video in future, in let's say 2031, this also might change, because Sustainable Development Goals are designed by UNO for only till 2030. There are some targets for it. Similarly, we do have dysfunctional uterine bleeding, but we have a broader term called abnormal uterine bleeding now. Okay, this comes in the menstrual disorders. Now this has a new classification called POM coin classification. Very important. All the causes of abnormal uterine bleeding in women are included, so that you go with a holistic approach to treat women with menstrual disorders. Similarly, we don't have acute renal failure. The reason being, there is no failure now because of the available techniques. Dialysis and renal replantation are early histological confirmation, early initiation of the treatment, availability of the immunomodulatory drugs. So we have injury. So now we call it as, okay, acute kidney injury. The same thing is true for chronic renal failure. There is no failure. We call it as chronic, not even injury, chronic kidney disease. Injury is an acute event, so it's a disease. So this change is very important in terminology, and both ARF and CRF questions are coming up. But when you write an introduction for these answers, you should say that the terminology has been changed, the nomenclature has been changed. Now we don't call it as CRF, we call it as CKD, because we were able to manage it. We are preventing patient to enter into the failure with the available medicinal techniques, right? Similarly, the same terminology applies to primary biliary cirrhosis. We don't wait for a autoimmune female to get into cirrhosis stage. We treat it early. So now we only have primary biliary cholangitis. So we are managing it at the stage of inflammation to prevent progress to the cirrhosis. So PBC is in the syllabus. They have asked question twice, and now we have PBC, that is cholangitis, not cirrhosis. Similarly, in the syllabus of OBG, they have mentioned it as leukorrhea, but when you observe MCQs, all the sexually transmitted leukorrheas are involved. So there is always a dilemma about leukorrhea. Even in my book and discussion, I told you that leukorrhea is non-pathologic, normal secretion in increased excess amounts, which is seen in pregnancy and during the menarche, right, in the menstrual age. But problem here is, even the pathologic leukorrhea or pathogenic leukorrhea is also in the syllabus. That's why they're asking questions on trichomonas, candida, right? So these kind of questions are coming. So leukorrhea has both non-pathological causes and pathological causes. This is one change you need to observe. And one more terminology is, we have benign breast disorders. Benign breast disorders like fibroadenoma, fibroadenosis, cystic megacelia. So all these things are there. Okay, cyclic megacelia. But we have changed it to new terminology now. The same thing has been discussed in the general surgery videos. That is, okay, aberrance of normal development and involution. So aberrations of normal development and involution of breast. ANDI is a broader term now for benign breast disorders. That's it. These are the subtle changes to the terminology in the syllabus. I have recorded a separate video on understanding syllabus of medical science for 1 hour and what books to read. I think this video is an add-on to that or a future video of that, wherein there are some subtle changes to the terminology that you need to focus upon. And very importantly, if you're targeting 2024, see, if you're targeting 2025, I'll be releasing a video after 2024 paper, because I strongly believe some of these topics unasked will be covered in 2024. So if you're targeting immediate attempt, the upcoming attempt of 2024, this part is very important, because so far they haven't asked a question on sustainable development goal. Okay, so far they haven't asked a question on waste management. Waste management has two aspects again. There is a hospital waste management, and also industrial waste is also given in the syllabus. I don't think they go to such an extent of industrial waste management, but they might ask these questions. And you know what I did? I have covered all these unasked questions as a part of test series. Okay, as a part of combo series, combo test, subject wise test, and as a part of daily answer writing programs. So if you are part of any of these three things, 95% of these uncovered topics are covered for 2024. Okay, but for regular videos I haven't done this because they are of low yield. If I keep on putting upon stress on uncommon things, what happens? You might master these uncommon things, but you will end up losing that 85% of the times which are common things asked. And where is your competition lies? So this exam is about, it's not beating your examiner, it's about beating your competition. So only focus on competition, and your competition is focusing on PYQs and PYTs. So if you want to beat an examiner and get 300 plus or 320 plus, then is the time to focus on these uncovered topics. But subconsciously, unconditionally, involuntarily, you will be covering all these topics as a part of our test series program or daily answer writing program, right? So you don't have to worry about that. So you have a hospital waste management and industrial waste as a part of PSM unasked version. Similarly, they haven't asked any questions on labor management in OBG. You might expect it in the future. What is the normal labor? How to conduct normal labor? What are the steps of labor and all? Dermatology, yes, they have asked everything, but vitiligo was asked long back. There's no repeat of vitiligo. Most of the time, they're repeating questions on psoriasis, lichen planus, and also scabies. Three topics are dictumly asked. I think they're ignoring vitiligo for last 10 years. I think the question might pop up this time. Similarly, from the surgery point of view, you have bone tumors. They haven't asked any question from orthopedics. They have asked questions from Colles fracture and fracture of spine management, but they haven't asked a question on bone tumors. They might ask this time. Similarly, endoscopy was not asked. Stones of gallbladder and kidney are important, but stones of ureter and bladder, they haven't asked any question. Similarly, cleft lip and cleft palate was not asked, and coarctation of aorta was not asked. All these things, directly or indirectly, are covered as a part of our courses. Now, yes, let's get into pediatrics. Actually, the neonatal resuscitation is not given in the pediatric syllabus. It's given in the OBG syllabus in the UPSC. But I think neonatal resuscitation, we learn it more from OPGI point of view, right? From the pediatrics. So they might ask a question on neonatal resuscitation. And 2D echo, yes, they have asked long back from radiology. There's no syllabus radiology. Don't take me wrong. It's given as medical imaging as a part of general medicine. But still, they have covered CT, MRI, 2D echo, and also ECG. And nowadays they're asking questions, a bit offbeat questions. What is the role of a particular X investigation in Y disease? So these kind of questions they're asking. So radiology is not there, but medical imaging is there. I have put it so that you will understand that radiology is also a little bit of UPSC medical science optional. So they haven't asked a question in the recent past from 2D echo. You might expect a question from this. And there is a confusion here with pharmacology. In the pharmacology, antidiuretics topic was given in the syllabus. It's given as antidiuretics. But so far they have asked only questions on diuretics part of antihypertensives. They asked a question on furosemide, thiazide, spironolactone. So antidiuretics are different, and the same question I asked in test series, and most of the students got confused. They started writing classification of diuretics in place of antidiuretics. Antidiuretics are different. We have Vaptons, right? V1A, V2 receptor antagonists. Okay, those are different. Argipressin, okay, AVP, vasopressin, these are antidiuretics. So this is also not asked. Okay, you might expect it in the future. Anti-Kala-Azar medication, antiviral and anti-parasitic. Yes, anti-parasitic, there are some questions have come up, but Of late, not many questions have come up. So these are the 4 areas from pharmacology you might expect a question. Now medicine, recently they asked a question on coagulation disorders, but yes, they might continue it. Similarly, Japanese encephalitis from infectious diseases, they haven't asked any question. Just make a list of these on a paper and just briefly go through them. Don't try to master them, but a question might pop up in mandatory section of question number 1 and 5 from these topics. If you have done this as a part of my regular course and test series, I think you will stand at an advantage over your competitors. But this is not your prime essence or prime goal. Your prime goal should to finish off 85% of the common things. Then come after this if you want to bring glory to the medical science and score high. Okay. Now next, microbiology. Giardia has not come up in the recent past. Pathology, osteomyelitis and tissue repair questions have not come up. In anatomy, yes, optic and auditory pathway, gonads. Auditory pathway, I think auditory cortex has been asked recently, but again, auditory pathway, optic pathway, gonads, the development of gonads and development of gut, testis and ovary related thing, they haven't asked many questions on that. And ventricles of brain, CSF is an ignored area from neuroanatomy. So these are the topics from hashtag unasked in anatomy. In biochemistry, renal function test they have asked recently, but again, so much of weightage is given to thyroid function test, and also what is the other thing, liver function test is most commonly asked in the mandatory section. So yes, renal function test they might challenge you with that. And the only vitamin they haven't asked so far is vitamin E, because it's of least significance in men but more significant for exam point of view because it is in the unasked version. The question might pop up, what is RDA, what is the resources, what are the deficiency manifestations, and what are the biochemical reactions of vitamin E. That's it. These are the topics that you need to focus for target 2024. I'll also release unasked, that is hashtag unasked target 2025 after 2024. If you are preparing for 25 attempt, don't worry, but at least these are the questions that let's see the paper and see how well we could predict. Because every year, for if you take last year in 2023, they asked the questions on chronic pelvic pain, which is pelvic pain is there in the syllabus of OBG and we ignored it, but they have asked a question suddenly on it. There are 1-2 topics they're asking like that. Okay, now next is, what are the gray zone areas in medical science optional? Very important. Why I'm calling this gray zones? It's not a scary word or a danger word. Don't take me wrong. We do prepare all these topics, but problem with these topics is they're extensive, and examiner can ask any question from this topic. He will not repeat the same question. He will ask a different thing. That means they have asked, let's say, trochlear now. They have asked facial now. They might ask oculomotor now or abducens now. So the closely related nerves. So depending upon that, we covered those cranial nerves in the latest thing, edition 2.1. Similarly, any vitamin can be asked. So we have compiled all the vitamins together in the notes. Similarly, any mineral can be asked. These days, they are even fond of asking minerals like selenium, zinc, fluorine and all. So you should be ready with deficiency manifestations of all the minerals and their metabolism. Now in renal pathology, you have spectrum of glomerulonephritis. You have minimal change disease, membranous glomerulopathy, focal segmental glomerulosclerosis, MPGN, and RPGN, rapidly proliferative glomerular, nephrotic syndrome, nephritic syndromes, post-rectal glomerulonephritis, IgA nephropathy, glomerular deposition disorders. I think there's so many diseases from which suddenly a question might pop up, because in the syllabus they just mentioned as renal pathology, and there are a lot of repeats from glomerulonephritis topic. And this is also relevant for PG, right? You will never see a question paper without a question on renal pathology on glomerulonephritis. Similarly, immunoglobulins, every time they're asking function of IgA1, function of immunoglobulin G, function of immunoglobulin M. Similarly, one or the other joint will be asked, be it be a hip joint or a shoulder joint, okay, or a knee joint. Every consecutive year, one question will repeat. Similarly, if they ask radial now, they'll ask medial now later, radial now, medial now, ulnar now, and Ebb's palsy, Klumpke's palsy. So peripheral nerve injuries are very important. They can ask any question about this. And any antibiotic, they ask penicillins, then they go for cephalosporins, then they go for broad spectrum antibiotics, aminoglycosides. So because it's a broad term given in the syllabus, you should be ready with all the antibiotics, their mechanism of action. That's why when I discuss antibiotics in the initial part, we did discuss general part of antibiotics in greater detail, so that you will understand mechanism of action of protein synthesis inhibitors, mechanism of action of cell wall inhibitors as a whole, so that you can cook your answer there, okay, even if you're not perfect in that. And yes, there are 2 areas in forensic medicine which are a headache. Any injury can be asked, including the victim of rape. Any poisoning can be asked, like 10 to 11 poisons they have asked. They have come to stage of lead now. So we have anticipated 3 more poisons for the future, and I have included in the edition 2 news, so that notes so that you should be ready with the new poisons. Similarly, they in the syllabus they gave it as kernicterus, okay, but they're asking a lot of questions on neonatal jaundice, and kernicterus is a complication of neonatal jaundice, and this is one area in pediatrics where you won't find answers from OP guy. The questions are directly coming up from the Nelson's pediatrics. Now, even I have upgraded all the pediatric topics from the Nelson's. Previously, we used to follow OP guy as a guide or a Bible, right? But now we have shifted to Nelson so that you tend to answer questions in a better way, because you won't find content enough to answer these questions from OP guy. So I don't want you to buy Nelson. Definitely, I'm pitching myself to buy UPSC Medico notes, because we are observing content, okay, at a minute level. We are observing the trend of the exam, the pattern of the questions, and what books the examiner is referring, how well you will be able to answer these questions with little efforts, because whatever we give you is so well cooked and well updated that you don't have to worry about all these manipulations on your own. Now, they have given in the syllabus of general surgery as splenomegaly, but every consecutive year they're asking questions on splenectomy. OPSI has been favorite obsession for general surgery examiner now. Lot of questions from opportunistic splenectomy infections, right? Now, post-splenectomy infections. Now, even from general medicine, there is a topic called malabsorptions. Any malabsorption syndrome can be a question. They asked celiac disease. They asked Whipple disease. Okay. Next time they might ask A beta lipoproteinemia. So there are almost 11 to 12 malabsorption syndromes. You should have a basic idea about all these malabsorption syndromes, because topic is so extensive and questions are coming. The same question is not getting repeated. They're asking a different question. Hope you're getting my logic behind why I'm calling it as a gray zone area, because though the name of the topic looks simple, they're asking different questions from the same topic, and now it becomes lengthy to revise, right? So that's why you need guidance in this area. Now you take complications of the cirrhosis of liver from general surgery. We read hepatic encephalopathy, we read spontaneous bacterial peritonitis, we read portal hypertension. So there are multiple complications associated with cirrhosis of liver. Though cirrhosis of liver is there in the syllabus both in pathology and general surgery, instead of asking only pathology or only management of cirrhosis of liver, I have seen many questions coming from management of complications of cirrhosis of liver. Similarly, if there is cholecystitis or gallbladder disease, management of complications of cholecystitis has been given more weightage. So you have to focus on this area. Examiner is shifting from a regular topic to complication related to that particular surgical condition. This is what your take home should be. As we already discussed, diuretics versus antidiuretics is also an important thing. Similarly, what are the complications associated with diabetes mellitus is also an important area, because they can ask question on nephropathy, neuropathy, okay. They can ask a question on diabetic foot. They can ask whether microvascular or microvascular, anything. It's an extensive topic. Similarly, meningitis, they can ask fungal, bacterial or viral meningitis, and meningitis is in what I say integration, okay, in vertical integration with even microbiology, okay, microbiology and also infectious diseases part of general medicine. A lot of topics they correlate together. Like if you want to ask cryptococcal meningitis, cryptococcus is a part of microbiology syllabus. Similarly, a lot of things changing from IMNCA, and a lot of questions directly coming from IMNCA. 2022, I got surprised seeing that how will you evaluate a baby on serious bacterial infection, suspicion of serious. This is offbeat question for 20 marks. So what examiner is trying to tell you is that in pediatrics, this IMNCA is very important for you. Now we have anus, anal canal, rectum. Every time new topic is asking from general surgery. Similarly, gallbladder and bile ducts also in general surgery. Every time new topic is coming. NRHM, RSH, nutritional programs. We all know importance of evolving health programs and what new health program can be asked as a part of the exam. We are ready with that. All our content and videos are updated as per the latest health programs. And in cyanotic congenital heart diseases, I think examiner got bored of asking every year tetralogy folate. Almost 8 to 9 consecutive years they have asked a question on tetralogy folate. We might expect a new questions from TAPVC or Epstein anomaly in the future. Now there is a confusion always whether it's a DNA fingerprint or only a normal fingerprint study, that is dactylography. The confusion got cleared last year because straight away they asked what are the fingerprints, types of fingerprints, dactylography, the holes, the curls, the voles, right? So both are different. More questions have come from DNA fingerprinting, less questions have come from normal palm wala fingerprints, dactylography. Now there is another gray zone, baby friendly hospital initiative. Okay, there was 10 steps of baby friendly hospital initiative, but examiner has moved on from it, and more focus is now on breast milk, the advantages of breast milk, the breastfeeding methods, sore nipple, anything related to the breast or breast milk or breastfeeding is very important from exam point of view, and it comes under baby friendly hospital initiative of pediatrics. The term is same, but the syllabus has changed. The focus is changed. Breast milk, anyway, what is the quality of breast milk, nutritional support, nutritional advantages of breast milk, technique of breastfeeding, everything is important. And now, I'll call it as red zone, not a growth zone. See, the problem with anatomy is a little bit extensive, the syllabus. On top of that, I don't know why examiner is asking questions from thorax which is not there in the syllabus. For example, there is a question on intercostal space. For example, there's a question on bronchopulmonary segments. Three or four questions have come just in the recent past. That means even examiner, instead of focusing on upper limb, lower limb, he's getting into a little bit of thorax also. So I think I have covered 2-3 future thorax topics like mediastinum, intercostal ribs, okay, intercostal now, just in connection with the previous year topic, so that you have a little knowledge about offbeat questions, but don't try to learn the whole thoracic from anatomy, because that is a time consuming and lowest yield thing. But it is a red zone, what I believe, from anatomy. The only topic which is coming out of the syllabus is this. In all the 21 years of papers, what I observed is the only topic which is out of the syllabus questions are coming is thorax. I don't know why the examiner is getting confused with this. So these are the gray zone areas in medical science optional, very important ones. So what I'm trying to do is all these topics I'm compiling a revision book, so that in the end you should be able to revise in the tabular form. So all the cranial nerves at one time, together, all the glomerulonephritis conditions together in a single table, all the complications of diabetes single table, all the immunoglobulins in a single table, all the joint related movements, everything in a single table, all the antibiotic classification, mechanism of action, side effects in a single table, all types of injuries. So I'm compiling it so that it becomes easy for you to revise just before the exam. I think that will add enough weightage to your final marks. Finally, PSM updates are very important. What I'm trying to do is PSM updates 2024, I'll be uploading a new video every year, so that you keep in touch with these things. Okay, I don't want to mix them together with this video. For now, what is more important for you is there are 3 areas wherein we are losing marks. First, we are losing the terminology part, and we are not focusing on unasked version, we are not focusing on the gray zones well, and we are not keeping update with the PSM. And you have UPSC MEDICO to do all these things for you. Okay, mark my word, every year my team will be focusing on updating these things with an updated notes and video discussion, so that, and also new questions in the test series, so that you are well versed with all these things, so that you can outperform your competition. You should never try to outperform an examiner, but you should be able to beat your competition and get that extra 20 marks, so that you bring back glory to the medical science as an option.